Good evening, Chairperson and other members. Monica McCain Brown, committee member.
Thank you. Sabin?
Good evening, Sabin Jacques, community member.
Simone? Oh, you're muted.
I'm sorry. Good evening. Simone Sylvester, board member.
Thank you. Ayana? Ayana, you there? Okay, I'll move someone else. Miss Reed?
Good night, everyone. Janice Reed, committee member.
Thank you. Amanda?
Good evening, everyone. Amanda Bilal from Bridging Access to Care.
Welcome. And Bernard?
Hello, good evening. My name is Bernard Skelton. I'm community liaison for the yard. And
Welcome.
thank you.
Welcome. Thank you for joining. So are you joining on behalf of the yard today?
Yes, I am.
Great. Welcome. Okay, thank you all for being here. So to start with the chairperson's report, as I mentioned last meeting, there will be a meeting this Thursday to discuss the future of SUNY Downstate. So I compiled all of your feedback from last week into a letter that I'm going to turn over to the Brooklyn Health Coalition, Health Equity Coalition, to be shared with that committee. So I'm planning to run through it when we go over old business, just so that to make sure that there was nothing else anyone wanted to include. We also got some outreach from some nurses at the New York State Nurse Association and Center Light Nurses. So there's a facility called Center Light that is in our neighborhood, that the nurses feel that they are being treated unfairly, and they wanted to share that information. They might come here at the next meeting if they're able to bring a representative. But the gist of it is on December 31st, the facility cut off their health insurance for nurses who wouldn't accept a deal to increase their healthcare costs. And they filed an unfair labor practice charge against Center Light. And the nurses themselves have been unable to access health care for the past couple of months. So they're looking for our support. So when I have more information on how they'd like to move forward, I will bring that to the group. Other than that, we are looking to host our health fair in May, just trying to solidify the date, but it'll be on a Saturday in May, trying to solidify the date with the board office. And then I will let people know, and then we can kind of discuss division of labor as far as making that event happen. And next meeting, we're hoping to have representatives from Share Cancer Support come to this meeting to talk about some breast cancer resources that are available for members of the community. So hopefully they will be able to join us for our March meeting. And that ends my report. Does anyone have any questions? Okay, I see we have a couple or someone else join the meeting. Khadijah, would you mind introducing yourself for the record and your relationship to the committee? Khadijah, can you hear me? Okay. Is Corinne Bellany on the call? No, okay, we had someone who wanted to make a presentation today, but it looks like they're not here. So if they join, we can add that. So the next order of business would be approving the minutes. So the board office shared the minutes a couple hours ago at about 4:46 over email. So you all should have approved that. Should have received that. So if you've had a chance to review, would appreciate if someone could move to approve the January minutes.
Simone Sylvester. To approve the minutes.
Thank you. Do we have a second?
Janice Reed, second.
Thank you so much. All in favor, please say aye.
Aye.
Okay. The meetings have been approved. Thank you. And for the record, Khadijah is saying that her background noise is loud, but I just want to note that I think this is Khadijah Oluo, board member. Is that who I'm talking to? If so, Ms. Lyons, perfect. If Ms. Lyons, if you could just note that her attendance here, that would be great. So next item would just be new business. So does anyone have new business that they want to share with the group?
The only news I will share is that a place that we've spoken about before, French Pilates, is opening up a second location at, I believe it's Nostrand and Rogers. It's close. Yeah, it's I'm not, they're on Nostrand now, but I think it's like it's like Nostrand. I'll look at my email and then I'll get back. But they're opening up a second location in April.
Okay, good to know. Thank you. Bernard, were you going to share something?
Yes, I was just going to say, good evening. I was just going to let people know about our town hall meeting that we have every other Tuesday, 10 a.m. and 6 p.m. if they are interested in finding out what's going on with the the FECEF, the yard, and also if they are interested in volunteering or being a PAC member, this is the place to come and tune in to actually find out what's going on. So I just wanted to share the word about that. Other than that, our grand opening is March 22nd. On Church Avenue. We're located at 3521. I'll put all my information in the chat. Other than that, we have offerings going on every other week. If not every week, we just had finished doing Black History Month cook-off where we had chefs and everything. And it had like maybe like 10 to 15 families that came through, and basically, you know, they cooked with us and everything, and they got produce at the end. It was very nice. And one of the politicians came out. It was a good look.
Could you, for the group, just share exactly what the yard does and what offerings you have?
Well, the yard is basically a community center that is ran by the community. So nothing we do is done without the approval of the community. And when we say the community, we mean the community, actually the community. Like our offerings doesn't happen without the input of the community. And offerings is basically the community giving us input about what they would like to see happen, whether it's coding classes, whether it's cooking classes, whether they would just like to get their laundry clean for free or at a discounted price, if they want fresh produce. It just depends on what the community tells us they're interested in doing. So we're always interested in hearing what the community has to say, and are always looking for volunteers that's interested in being PAC members that could also help collaborate with us to actually throw these events. We have a virtual teen youth circle that's hosted every week by Zenobia, our community liaison. We have 2 community liaisons, 1 family advocate, and we have a director. And we're a 4-man team, and we basically go out in the community and try to get the community interested in just helping themselves. And that's all they have to do, is just tell us what they're interested in. And we go out and try to make it happen, and try to be a bridge between those that are listening and those that's not being heard. So our new community center that's opening, I'm sorry if I'm being a little too long, but I'll hurry up.
No,
Our
you're fine.
community center is a center set up to where businesses and organizations can come use our conference room if they need. It's internet ready as far as WebEx, Zoom, or any other internet service or app that you use. We have a section for the little kids. We have a section for the teenagers if they want to watch games, or if there's an event going on. We have a kitchen area. We also have a section for those that want to study look for jobs, look for school, do reports. We have a section for that. We also have an area that is accessible and easy to get to and utilize for the senior citizens as well. We also will have a food pantry. We'll have also a clothes closet where people can donate clothing, and we actually clean the clothing. We have a laundry room where we actually clean clothing, dry them, fold them, hang them up, whatever we need to do, and give back to the community as well. And we are starting also a toy chest where we collect toys throughout the year and we give them out during events for the kids, or we wait till Christmas. Besides that, we also, real quick, we also have a women's virtual group that happens every week, every Tuesday. We also have, like I said before, our town hall that happens every other Tuesday. And like that's hosted by me at 10 a.m. and at 6 p.m. 2 different times with 2 different QR codes. And we have our grand opening and our introduction for the people that want to be PAC members. So right now, that's it from me, and I will put my information in the chat, and thank you for the opportunity.
All right, thank you. I appreciate it. Any questions for Mrs. Skelton?
I do have a question. You mentioned that on the Tuesday, there's a meeting, I think at 10 and in the evening. Are any of those meetings virtual, or are they, do you do one virtual, one, I mean, how is it set up? I'm just curious. Thank you.
They are actually all virtual, and all you have to do is scan the QR code. I'm gonna put my email and everything in the chat, and I will be able to send you guys the information. You ladies, the information, pardon me, all the information that's upcoming events, as well as the town hall for tomorrow.
Thank you.
Thank you very
You're welcome.
much. Any other questions? Okay. Does anyone else have new business that they'd like to discuss today? Yes, Simone?
So I just wanted to say the second location for Fringe Pilates will be at Clarkson and Rogers.
Got it.
Opening in April.
Have you had any contact with the owners to know if they are interested in like having more community involvement?
I think so. Now that they're expanding, they indicated, at least in one of the emails, they're looking for partnerships. And so I'm not sure if that includes the community board, but I would think so. But they're actually looking for different partnerships.
Okay. Okay, noted. I'm thinking maybe we can reach out to them for the spring health fair. Maybe they'd be interested. Bernard, you as well. As I mentioned earlier, we're planning to have a health fair early spring in May. And I think it'd be great maybe if the yard has a table, you know, I will say at the board fair that we did last October, an organization brought like vegetables and did like a healthy food demonstration. This fair is very specifically like focused on health. So I don't know if you have any programming that's like, you know, very focused that way that you might want to participate, but definitely open to your partnership in that.
Well, I'm actually interested in that. It's funny you say that. I'm actually putting together an offering for healthy eating through smoothies and a demonstration using a local juice bar or juice and health bar owner and his organization. Use him to demonstrate for a group of people how to basically not only revitalize yourself, but have it detailed to what your needs are and to keep you going in a healthy way instead of relying on other methods that have proven to fail us time and time again.
Yes, absolutely. That would be great. I know I think it was I can't remember. It was one of the hospital. I think it was OBH. OBH came and they did like a salad and they, you know, chopped vegetables and like mixed it up and they had a salad recipe and they had
I
the
just
recipe
finished
card.
one.
There you go. And people loved it, man. People, you know, they kept coming back to the table. They kept, you know, asking more details on the recipe and stuff. So there was a lot of engagement there. So I think it'd be really cool if we could bring that back. So we'd definitely love for you to be there. So it's in May, so you have time to work on your recipes and stuff and get details with the juice bar owner. But we definitely would love to have you.
All right, cool. Thank you. Thank you.
Of course. Great.
have, do you want me to reach out to Fringe Pilates and see if they're interested?
Yeah, I think that would be great. I know last health fair we had a karate instructor do like a little demo. So I'm wondering if, maybe they do like a mat Pilates workflow with people because we're gonna be in the park this time, so there'll be space. So I
Okay.
think we cool. Yeah, so would love to know if they're interested.
Do we know when in May?
The date is not solid, just
Okay,
because,
okay.
yeah, but
I'll reach out and I'll have an answer by the next meeting.
okay, and it'll likely be on a Saturday, and we'll have a date by the next Saturday, by the next
Okay,
meeting.
okay.
Yeah. Great. Okay. Any other new business anyone wanted to bring up?
Yes, hi. So
Hi,
my name-
welcome.
Thank you. My name is Amanda from Bridging Access to Care, and we are a multi-service nonprofit. This is going to sound repetitive. These town halls are fun, by the way. I attended the last one. Go for a good time as well as information. Just a quick plug there. But we have a number of great programs for the community. So we have a mental health clinic, and we see youth ages 6 and up at our Williamsburg site, which is 390 Berry Street. And I love to say the great thing about the youth and adolescents is they have their own wing. So they're not waiting in a general area where you see adults who may be in various stages of crisis. So I think that's super helpful. And we also are able to have satellite services at our Church Avenue location. And we are currently accepting referrals if that comes up as a need. We also have a substance use clinic, and they have groups and all the things to meet folks where they are. I think it's also important to note if someone is still struggling with use, sobriety is not a requirement for receiving services. We are trauma informed and we meet our clients where they are. We also have social support services and a housing department, which helps with accessing supportive housing. Now we have a new tree program, which is located out of our Flatbush Gardens location, which is 3301 Foster. And they have this great program for unhoused youth ages 18 to 25 who are struggling with substance use, and maybe they're couch surfing, maybe they left home, maybe they got kicked out. We help them navigate their substance use as well as getting linked to housing. It can be something even vaping or tobacco use. They will still be able to receive services with us. Now, if the question comes up, what about folks who are over 25? We have a GBHI program which offers the same services, but just older. We have a prevention education department. And what I love about this department is we have health educators who are in middle schools and high schools delivering evidence-based interventions to the youth. Drugs, healthy lifestyles, and they are through the Office of Substance Use and Addiction Services. We also have free HIV, Hep C, and STI testing. Now, we have 2 mobile units that are available to go into the community where there is the need and bring the services to folks. Sometimes it's that first step into a brick and mortar, it's a hard first step. But because we're there, we try to be as visible as we can. We are able to offer free testing on the mobile unit, the larger mobile unit, as well as offering, we have a nurse practitioner that's there to assist with screening, medicated assisted treatment, as well as we have phlebotomists that can do like blood pressure readings if necessary, right? So we try to make this, we can also offer telehealth services over there as well. So we try to make it as wraparound as we can. The smaller mobile unit, we only do HIV and Hep C, but we're able to just be in more spaces this way. So I think I hit what we do. Maybe I missed something, but I wanted to share information with CP17 because it's so integral. And sometimes folks don't know that they need the help if the help isn't available. So let me see where is popping in. Thank you.
Please, you're very, very welcome. Thank you for that. Want to open the floor if anyone has questions. My first question is, what are the sort of like health insurance requirements for getting help from you, different services?
We accept most health insurances, including straight Medicaid. So if a client, let me put it this way, if a client comes in and they do not have health insurance or they are undocumented, what we do is we connect them to agencies that would be able to assist them. So
Okay,
it's
got
not as if someone comes and, oh, we need help. Well, you don't have the insurance, so bye. No, absolutely not. We perform that. We have navigators that help perform that linkage.
Got it. So you
Within
do
the territory.
need health insurance in order to use your services, but you will support people.
You can, for the testing, the mental health, and the substance use components, and
Okay.
like health through social support. But our testing is free, and the presentations that we do and the interventions that we do, those are also free. So, for example, I've started a series of wellness presentations. Sometimes folks just, they're very, very simple, but sometimes understanding what wellness is and how everything is connected. If you're worried about your finances, you're not going to say, what's a new hobby I can do for self-care? You're worried about keeping your job, right? So talking about how all of these dimensions of wellness is connected, and that's something I do for free.
Got it. Okay. Thank you. I know Khadijah asked for your contact info in the chat. If you could just put it in the chat so I can save it, that would be great. And if you have like a website or anything else, but does anyone else have questions? Okay, could you also just restate the locations? I know you mentioned there's like a Williamsburg location, but yeah.
So we are located at 2261 Church Avenue. We are located at 3301 Foster Avenue. That's Flatbush Gardens, and that's located within that development. And we are located at 390 Berry Street, which is in Williamsburg.
Got it. Okay, so two local locations, which is great. Okay, fantastic. Thank you so much. Please definitely put that info in the comments. Great. Any other questions? Nope. Okay. Any other new business? Okay. So moving on to old business. For old business, I just wanted to, or unfinished business, I wanted to run through the points that I captured from our last meeting that I'll be sending over to the SUNY Downstate crew, just in case anyone has anything else to flag. I have a full letter. I'll send it across just so you can see, but the bullet points are scheduling and patient management, accessible medical records and a medical record system, patient advocacy and alternative treatments, doctor availability and staffing, facility maintenance, so the general cleanliness, sanitation of the building, community hiring and education initiatives, so trying our best to hire people from the community and having education initiatives within the community, nursing and staff support, and those are the top bullet points that I have. So is there anything else? Reminder, it's a call to basically advise the committee on how they should be spending the governor's investment in sort of revitalizing and maintaining downstate. So if there's anything else we want to pass through, I encourage people to attend the meeting on Thursday. I'm going to attend, but if it's anything like the last one, so many people speak that you might not get a chance to get up to the microphone. So it's best to put your points, in written communication. So anything else that I didn't capture that anyone can think of?
So I don't. So I'm not too familiar with, I guess, the layout of the hospital. I assume they have a chapel. Um, Similar to an airport, how they have a meditation room. Do you know if that's something? I mean, like, medicine is good, but sometimes a little down room would be helpful. So that's just a suggestion. So a possible meditation room for someone, not so much walking into a chapel, but just some place to just go and stretch and think. And so that's just an idea if they have space for a room such as that.
A wellness space. I like that. Yeah, I'm not positive they have a chapel because remember it is a teaching hospital, so and it's pretty small. So I don't know. But we can find out. But I do like the idea of a wellness space. And Khadijah, I just saw that you put doula services. I also just put my points in the chat so you can all read them. So yeah, the doula services, I appreciate that. I know maternity or maternal health and wellness did come up, so I will add that there as well. Welcome, Vanetta and Ms. Douglas. Sorry, I didn't acknowledge you both. Would you mind introducing yourself for the record? Ms. Douglas, you can go first.
Hi, good day. This is Judith Douglas Lord, member.
Thank you. And Vanetta,
Hi, this is Benetta Sylvester.
welcome. And your relationship to the community?
I live in the community, and yeah, I live in the community.
That's right. Community member, thank you. So we're just talking about recommendations to pass on to the SUNY Downstate Committee. So I put some in the chat and just open the floor if anyone else has anything to add to the letter before I send it over. I'll add that wellness, maybe like meditation, something like that, space. Nope. Okay, does anyone have any other unfinished business to discuss? Nope. Okay. Well, thank you everyone for attending. I think this was a very successful meeting, even though brief. We love brevity. So Bernard and Amanda especially appreciate y'all, for sharing what you do. Bernard, I know you regularly attend the board meetings on Wednesdays, so definitely appreciate that. Amanda, curious, would you like to attend the board meeting, or would you like me to share about information about your organization at the board meeting, which will be the third Wednesday of next month?
I'd like to attend.
Okay. Great.
Yes.
Yeah, so we'd love to have you.
This meeting, is it the same invite or, because I couldn't access it easily?
Okay, so this one gets emailed out to people on the list, so we'll make sure that you're on the list. It gets emailed a week before and then the day of. And then the Wednesday meeting, a general email goes out, but that one is the third Wednesday of every month in person at SUNY Downstate.
Thank you.
Of course. And Bernard, will you raise your hand?
I just wanted to add, I don't know how I left this out, but my 6-year-old was born at SUNY Downstate, 2018, and when you ask me what's my ties, I actually do have personal ties to community because he lives right on the same block the community center is on, but in the middle of the block of Brooklyn Avenue. So I'm always on that block whether I'm working or not, because I'm doing double duty with doing daddy services when I'm not working. So have ties to the hospital, have ties to the neighborhood.
I love that. That's great. I'm actually I pass the yard every day on my way to the train station, so I'm definitely gonna stop by. I'm on Brooklyn, so
Stop in,
definitely.
please. Stop in, have some coffee, have a muffin, a bagel or something. Please do.
Okay, listen,
Everybody, actually.
I work remotely too, so don't let me bring my laptop over there and start bothering you. I will sit down.
Hey, we have mobile tables. We have mobile desks where we have seats with wheels. There's more than enough space. Like I said, we have the spaces for everybody. Businesses, families, individuals, young, old, middle age, unaging, aging backwards, whatever. Like it's for everybody. So everybody, anybody, don't be shy. Everybody's more than welcome. Everybody's welcome to the grand opening. And we just look forward to doing great things with the community, for the community, and on behalf of the community.
Amazing. And both of you, Bernard and Amanda, I would encourage you to contact the board, the office staff about making sure you're in the newsletter. I wrote down your information, so I'm going to pass it to them. But, they're sending this newsletter and we're building the list up. So it's like a couple thousand people. So to make sure that, people are also getting your information by email would be great, because these are both great resources that I want people to be able to take advantage of. Great.
No problem.
Okay.
Thank you.
So that's our full agenda. Thank you again, everybody. Really appreciate the attendance, appreciate the participation. And if you can make it out on Thursday to the SUNY Downstate, the meeting is going to be at Medgar Evers. Would love to see you there. And otherwise, we'll keep in touch. If you have any questions for me, please feel free to email me at any time, or email the board staff and they can get in touch with me. And we will see you next month. Could someone please move to adjourn?
Simone Sylvester moves to adjourn.
Thank you. Can we get a second? Bernard, second.
I second to
Sorry.
adjourn.
Thank you.
I'm sorry,
Yep.
may I ask a question, please? Sorry. You
Oh,
just
no.
mentioned that the meeting will be at Medgar Evers, that
Yes.
next meeting.
Yeah.
What time will it be?
The next downstate meeting, I believe it's 6, but let me
If you
pull
could
that
just
up.
share that information. If you can always email it. No,
Okay.
don't want to
Yeah.
put you on this, because we're good. Thank you.
Yeah. Hold, I have it. It says 6 p.m. It's from 6 to 9. I'm gonna just drop it in the chat.
Thank you so much.
No problem. No problem. All right. Hope to see you all there. Declare this meeting adjourned and have a wonderful evening, everybody. Thank you all so much.
Bye-bye.
Okay, good night.
You too. Bye-bye.
Good night.
Thank you, Ms. Lyons.
Thank you.